Well, hello everybody. Welcome to the Festival of Social Sciences event, Nothing About Us Without Us. What can the COVID-19 pandemic teach us about disability justice? My name's Professor Dina Kiwan and I'm at the University of Birmingham. First of all, just some housekeeping. The event has live captions, which you can enable by clicking on closed captions at the bottom of your screen. And Vicky Carabin is our British Sign Language interpreter. If you're a British Sign Language interpreter user, you need to pin her on your screen by right-clicking on her picture and selecting pin. So this will make sure she is visible. If you have any technical questions, you can put these directly to tech support. So if you go to the drop-down menu in the chat, you can select tech support, and then you can directly put any questions that you have of a technical nature, and then you'll be have a direct response back to you to help you with any issues. Then when it comes to the speakers, if you have questions for the speakers, you can use the chat, but you can just address that to everyone, and then everyone can see the questions being put to the speakers. And these will be answered after the panel discussion. This event's emerged out of an Arts and Humanities Research Council funded research project that started over a year ago now. It started in September 2020, that myself and Vera Kubens have been working on. And this has looked at the impact of COVID-19 on disabled people in low and middle income countries, and working with the UN Partnership for the Rights of Persons with Disabilities to produce a framework for a disability inclusive recovery. This event is going to focus more broadly on some of the topics that emerged during our research, and we'll be hearing from a panel of disabled people on their experiences and thoughts about what we need to learn from the pandemic about disability justice. But first of all, I'm going to hand over to Vera, who is going to give an overview presentation on what we've learned from the research on impact before moving to the panel discussion. So welcome once again, and I hope you find this a thought-provoking session. Thank you.
Muted. Thank you very much, Dina, for the introduction. So I'll start by giving a quick overview of as Dina said, of the findings from a literature review that we conducted on the impact of COVID-19 on disabled people in the Global South. And then we'll have a panel discussion with four disabled activists from different cultures and backgrounds. And then we'll have some time at the end for a Q&A session with the audience. So you can raise your hands at that point, or at any point, please put your questions in the chat, and then we'll pick them up at the end. So the literature review we conducted was looking generally at the impact of COVID-19 on disabled people in low and middle income countries. And we looked at the sectors of health, education, community, and economy, but the findings I'm presenting are really more about the general themes that came out of the literature review across all four of these sectors. The first and probably most striking one was the exclusion of disabled people from pandemic planning processes. Most countries did not consult or involve disabled people in planning around the pandemic, and as a result, disabled people's requirements were not considered. They were often actively excluded from plans. And as a result, they faced significant issues accessing information on COVID-19, as well as being able to access medical care for COVID-19 or general medical care. And also there were issues around receiving financial support and accessing employment and education. It's really difficult to assess the precise impact because most countries have collected little data on disabled people during the pandemic. So a lot of the data where it was collected is not disaggregated by disability status. And this is important because data is extremely crucial to assess the impact on disabled people compared to the general population. So if you don't have that data, you're not able to put in place mitigations or plan for making services accessible to disabled people. And another issue is that there's also often no baseline data, so that data hasn't been collected historically. So it's very difficult to compare it to any existing data because that's also not been collected. So there's a lot of learning points about how data on disabled people and different groups and populations of disabled people is collected globally. We also found that there's still a lot of medicalization of disability. So it tends to be seen through a medical lens and as an individual medical problem rather than as social or political issues. And disabled people were often described as vulnerable, particularly vulnerable to COVID-19. But the causes of that vulnerability were often not really recognized or discussed. And a lot of them are around existing barriers that were exacerbated during COVID-19 or new barriers that were created due to the lack of planning. Most of the research that we looked at during the literature review focused on health. It was by far the largest section, and there was not nearly as much on education or some aspects of community, and in particular, the access to culture, access to sport, and access to religion were very. There's virtually no data on those topics because they're not considered something that disabled people should access. It's also really important to see the whole picture. So as I said, we looked at 4 distinct areas, but many of the issues faced by disabled people are actually interconnected. So for example, access to food was an economic issue because food poverty was the main form of poverty experienced by disabled people in low and middle income countries during the pandemic. But food is also an issue of transport, where a lot of disabled people were physically not able to obtain food because there was no public transport, and roads and infrastructure was not accessible. And it also turns into a health issue if nutritional deficiencies mean that existing impairments are exacerbated, or that or new impairments are created due to lack of access to nutritious and varied food. The development landscape is currently that a lot of funding for disabled people or for project is isolated, it's time limited, it focuses on the specific project to improve a specific area, but it doesn't really recognize the bigger picture. It's also often not disability specific, so it's highlighted a lot of issues with current approaches, and new approaches are needed to make sure that projects around development generally and disability specifically are focused on a holistic view, more of a holistic view, and on foreseeing the big picture and building sustainable long-term institutions. On a more positive note, one of the things that we found a lot of is mentions of mutual support, where disabled people's organizations in particular stepped in to provide crucial support to disabled people through access to food, medicine, and access to reliable and information on COVID-19 and how to protect yourself. A lot of the time, disabled people's organizations stepped in where governments were not providing that information or that access. And on the one hand, that highlights the resilience of disabled people and our movements and the way that we support each other. But the question is, what is the cost? And does that really excuse the wider society not doing these things? So it's not something that should be on the shoulders of disabled people. There should be more responsibility taken to look after disabled people and make sure we are actively involved in planning in wider societal and governmental responses to the pandemic. So for some disabled people, there were some positives in a way that it has opened up more flexibility. We have discovered new ways of doing things, and we have discovered new ways of living. But on the other hand, these new ways were not magically accessible. They also created new barriers. And one big barrier was particularly around technology. And that's the case. I think globally disabled people are less likely to have access to technology and particularly to the internet, but it's particularly exacerbated in low and middle income countries where there isn't as much infrastructure to start with. So lack of access to technology and lack of access to IT infrastructure was an issue, and also then the accessibility of technology. That was a major barrier, particularly in education, when a lot of schooling moved to remote ways of delivering school, and disabled children, particularly disabled girls, were most likely to be excluded as a result. So the question there is then, how can we build on any gains that have been made and use these as a starting point to imagine different and better ways of living and being? So that concludes just a brief overview of some of the questions and themes raised by our research. And I'll now be handing over to our panel. We've got 4 disabled activists, including Dr. Ratan from the Indraprastha Institute of Information Technology from India. We've got Hala, who's a disability activist and consultant from Jordan, Samuel Odawo from the Ulemavu Research Institute in Kenya, and Sophia Brizio, a freelance translator and researcher in publishing from the UK. I'll just unshare my screen. Okay, so the first question today is around technology. And the question is for the panel. So what role has technology played for disabled people in different contexts during the pandemic? And what is needed to facilitate access to participation and information? So Sophia, would you like to
Yes,
tell us your views on that question?
Hello. Thank you. So yeah, I would say in general, technology is liberating, but there are intersectional inequalities that need to be considered, as well as different kinds of disabilities. And my research on the impact of COVID on disabled people working in publishing in the UK, which I carried out on a small scale as part of my major project at Cardiff University, showed that all disabled people who took part in the research found it easier to work remotely during the multiple lockdowns due to being in control of their own environment. But on the other hand, some didn't have access to a quiet space to work, for example, or could not afford the technology needed to work from home. So I think we need to recognize that technology is vital to disabled people in every area of life, not just work. And we need to strive to make it as accessible as we can economically as well. Thank you.
I would agree with Sophia's, kind of critical, idea that she foregrounded, is that if you look at technology's role and its impact on the disability community in COVID, I can speak from India's viewpoint, but I'm sure it is similar across a lot of developing countries, that intersectionality is a very critical perspective that we need to take in order to be able to summarize how technology can benefit or not benefit people. Especially in India, the digital divide is very, very big, and that's also intricately tied to the socioeconomic strata. So when we look at who gained from technologies is, directly reflected on who has access, and access is intricately tied to the socioeconomic strata. So I think in COVID, people who were more privileged or more of a higher socioeconomic status really benefited very well, because then when everything moved online, it became much easier to access a lot of things. In education also, people were able to access it more easily. It was not such a big problem for those who have access to technologies, but those who are on the margins, they suffered a lot when especially a lot of government work, government related policies that were instituted to eliminate poverty or hunger were moved online. Then people who are already on the fringes suffered more. So people had to apply for food benefits or some benefits, economic benefits that the government provided during this time. They moved everything online, and those who already had lost jobs were further marginalized because they didn't have enough money to even pay for their mobile phones or apply for various programs or facilities. So I think that's something that is seen in India to a large extent.
My name is Hala from Jordan. So here in Jordan, long time before the pandemic, disabled employees were calling for a more inclusive workplaces, and many found it difficult to get these accommodations like working from home. It was not an acceptable culture. Also, or finding any flexible working hours. And employers were able to reject it because of the lack of awareness, while the Jordanian law contains the headline that focuses on employment reasonable accommodation. So after COVID-19, employers find themselves doing this by default. And also they implemented this kind of accommodations across the board in order to keep things afloat during this global pandemic. But unfortunately, we still have exclusion for persons with disabilities, or a lot of amount of people of the country, because they were unable to connect to the internet. Some families may share the same computer, others may not own computer at all. We need to find through partnerships with government, business, and educational systems, or work the Ministry of Labor to provide computers and internet access to all workers and learners, because there is many limited low-income families. Also, maybe it will double the effort for some caregivers to facilitate these accommodations. We have also not to forget the other accommodations, just like sign language for deaf people, and to facilitate the materials for blind people in a way that the reader can read them. So it's not about physical disability, but maybe the technology facilitated a lot of culture that we missed before this pandemic.
Hello, my name is Samuel, and maybe if I could just add something little on technology. First, I want to make a general comment that overall, the development in technology has helped to mitigate the challenges, the adverse challenges that persons with disabilities would otherwise have faced due to COVID-19 pandemic. However, it is worth understanding that disability is not homogeneous, it is heterogeneous, and therefore people are impacted differently depending on the category. Whereas technology has somehow enhanced access to information and improved collaboration among persons with disabilities across the globe, the challenge is that it has helped more those who are educated and have got access to technology. But for persons with developmental disabilities who depend on caregivers or their parents, that has become really difficult because most of these parents or caregivers, most of them will not be having, probably will not be able to have knowledge or are not technologically savvy. And so that affects the persons with disabilities. Another huge challenge is access, particularly in the global South. Access to these mobile devices, access to the internet is a huge problem. And therefore, access and affordability. Sometimes you're able to access the mobile devices are in the shops, but they are not affordable. So to those persons with disabilities then who are not able to afford such technologies, then it becomes really difficult. So I think in terms of what could be done is improve on accessibility, affordability, and maybe So that would happen if governments in the global south would partner with development partners or even manufacturers of such technological devices so that they are easily available to persons with disability. That would really have helped. And of course, the last thing I would say is the need to focus on supporting caregivers and parents, because when experts or professionals who are taking care of these persons with development disabilities are not able to access them because of the social distancing rules that are there, or COVID-19 protocol measures, then parents now are given the responsibility to take care of these people. And if they don't have information, if they don't have the know-how, then it becomes really difficult. So that's an area that really need to be looked into. Thank you.
Thank you very much, all of our panelists, for really interesting answers. So we'll move on to the next question, which is around innovation and some of the positives that might have emerged in terms of flexible working, learning, or working and learning or living, and how this can work in different contexts, and how we can make sure that we keep some of the positives and some of the benefits that have emerged. Hala, would you like to speak first on this?
Sure. So now many disabled workers also face discrimination because of their co-workers related to the flexible working hours, and I faced this challenge actually many times because flexible working hours can help a lot each case in a way or another, like to change the start or finish time, for example, by allowing employee to start late or to finish earlier in the day, or offering split shifts, or offering employees breaks during shifts. Employees were often rigid in their views towards time for example, medical appointments, or such as people with disabilities and chronic illnesses have been campaigning for flexible working hours for many years. So flexible working hours is a major requirement for persons with disabilities to provide this work, because if they maybe 1 hour or 2 hours can let's say prevent the person with disabilities to show up for the whole day, or maybe the lack of accessibility in toilets and so on. So the importance of flexibility working hours is a major challenge, but always the managers link it to productivity. They believe if they provided it, this means that person with disabilities won't work the same way. But many numbers and research found that flexible working hours increase the productivity for persons with disabilities, because they accomplish, or let's say they cover all requirements they need for their work, so they can achieve more and be more productive, more participated, and to do all the tasks on time regarding other challenges they face.
Yeah, I think it's I agree on everything you've said, and definitely although for me from a publishing perspective, and taking into account my privilege as a person who lives in a country which has on average more access to technology, I think that everything being remote has helped me a lot in finding jobs as a recent graduate as well, in that I didn't have to commute, and also my disability isn't always that visible from the waist up, so I didn't necessarily have to disclose it when applying for remote positions for which my work as an activist wasn't relevant, because obviously I could work from the comfort of my own home and manage my symptoms. Of course, I'm aware this isn't the same for all disabilities, and in no way am I encouraging not disclosing, but I think it just goes to show how needed these reasonable adjustments are to level the field. And in my case, they also allowed me to progress career-wise. And as for networking and attending events, which is a big part of working in publishing as in any other creative industry, I can safely say I've done more networking since the start of the pandemic than ever before, because I didn't have to worry about the accessibility of venues. And the publishing industry generally proved it can function remotely and accommodation should be kept. And as for how we can keep them, at this point, I think it's up to employers and companies to be flexible with their disabled employees for everything that can be done from home, not just in publishing, but in every industry, as well as maintaining the online alternative for every in-person event, which I think is essential for inclusivity, especially in a UK context now, taking into account the COVID situation.
Thank you very much. Ratan, is there anything you would like to add?
Yeah, I think from my point of view, I'm actually an assistant professor in a university. So the kind of work environment we have, disability has never been a problem. But if you look outside that realm, one of the things that I found was organizations are now grappling with new ways of understanding how to make accommodations for people with challenges. I mean, challenges are not homogeneous, and there's a mobility issue. For people who are problems with challenges with mobility, it has found it's much more easier now to be part of the organization. They don't have to travel, but they can be productive at home. Their environment is much more conducive to their challenges, and so that's positive. But on the other side, what about people with a range of disabilities, right? So organizations are finding it increasingly difficult to grapple with how to accommodate these people and still make them part of the productive workforce. But on the positive side, I think in countries like India, where these issues are not deliberated, these issues are not foregrounded, this last 2 years in India, especially the lockdown and the consequences, have actually put these issues again into the forefront. They have brought them back into into the foreground and brought the focus on these issues. And so also the need for grappling with the issues more realistically. Now, people have been forced. The spotlight that has brought in also made organizations to think harder, to be able to make more inroads in making disabled people more inclusive into the community. And so we are testing out new models. This has also become an opportunity for testing different models for both different types of organizations to make themselves more inclusive. And I think that is something that is very positive, because the conversation has started. People from policy bodies, people who work at the grassroots, non-profit organizations have found ways to make these problems more visible. Also, they are also experimenting and innovating and learning from the experience of supporting a wide range of people with disabilities. So I think there is something positive to learn from. And there's also, unfortunately, other thing that I have found, a lot of people with disabilities are social isolation has increased. For some who were able to be part of something by going out and working, has now found, COVID to have exaggerated the loneliness, the social isolation, and that in turn related to mental challenges and all that. And at the same time, organizations have found innovative models to support the community. It has become all the more important to, come up with long-term plans to be able to sustain this even after the COVID. So I think we have to see the positive outcomes, not only as part of the COVID, but also as change in the process, change in the thinking, change in advocacy, and foregrounding the importance of making inclusivity a very important factor to think about when we make any policy that relates to, that traditionally in India has been very exclusive or non-inclusive.
Thank you very much. The next question is about survival and the ongoing and long-term challenges that we face still in each of countries and cultures. So the pandemic is far from over. So is anyone, Samuel, would you like to start by discussing sort of that topic.
Yes, on survival, if you allow me to connect it to innovation and then bring survival here, I just want to say that fortunately, because of the COVID-19 protocols, we are able to have this meeting owing to technology. And that is, the innovation that has helped us to be able to meet, Sophia from wherever she is, Ratan from India. And these are things that we can continue with as persons with disabilities for better learning. It has been often difficult for persons who are blind like myself to access information. We've suffered those of us who have got print disability have really suffered accessing information because of much of it being in print. And so COVID has necessitated that a lot has been digitized. So that becomes easier for many of us. The other thing is employment. Disability employment has been a big problem. And even as we keep, going forward, this is something we'll still have to work with. But look, COVID has taught us that we can work from home. So those who've been fearing to employ persons with disabilities, particularly where there is inaccessible work environment, or they find it difficult to institute reasonable accommodation, working from home has become the new norm, the new normal. So that's something we can do. So we have survived through COVID. We have learned a lot through it. And going forward, even though we still have challenges with accessibility, particularly technology, what we can do is how do we ensure that these technological devices are accessible to to persons with disabilities? How do we make internet access a basic need? Because probably developed countries have really done a lot in that regard, but in the global south, that is still a huge problem. Social protection, going forward in terms of surviving, that's an area that policies will have to be made. Because I know that in Kenya, for example, we had a COVID intervention fund, but that was almost like a drop in the ocean because of the people that were, the sheer amount of people who are targeted were very few. So maybe going forward, that is something that you want to do. I think also we as persons with disabilities pulling together, learning from each other, both locally and globally. It's something that is going to help us if we are to survive the post-COVID. We call it building back better. If we are to build back better, then we have to have synergies where we persons with disabilities in Kenya and those in India and Jordan and other countries, we have to use innovation to then come together and discuss more and learn from each other, because our challenges are basically the same. I just saw somewhere, I think one of the charts here, that poverty is affecting persons with disabilities, both in the global south and even in developed countries like the UK. So sometimes we might be saying that we are hugely challenged in the global south, but some of these challenges could be facing our colleagues in developed countries. It is when we come together to learn from each other that we find probably we are sharing similar challenges, and then we may exchange solutions that probably have worked elsewhere, and they may also be replicated in our context. So I think that's something I would like to say on survival. I think we have learned, and just like maybe the last thing I can mention, because of our survival mechanisms, we have developed something called alternative mechanisms to do things. And that is something that the non-disabled can learn from us. Because we have gone through discriminations, we've gone through marginalization for a long time. We have come up with alternative mechanisms to survive. The non-disabled can learn this from us, and we should be willing to share it with them, that regardless of the challenges, when we pull together and when we focus on finding a solution, we can always come out of it.
Thank you very much. Sophia, is there anything you'd like to add from the UK context?
Yes, so I'll try to be as brief as I can, but personally, and perhaps, naively, I thought that the effects of the pandemic were going to last, but obviously now everything's becoming more inaccessible again because the UK is sort of pushing to going back to normal. And in my experience, I remember at the beginning of the pandemic, two sort of online strategies used by Penguin, the publishing house, which were the Penguin Perspectives hashtag and the At Home with Penguin hashtag on Twitter. And they were designed to encourage a reflection on, you know, what society was becoming with COVID and how we could connect with each other from home and online. And I think it was a chance to change society for the better that we didn't really seize in general, I think. And the majority of big employers, especially in publishing, now are pushing for a return to the office, which for many means moving to London. And this is not always accessible for a variety of reasons, but again, the publishing industry has proved it can function remotely. And there are a lot of independent publishers who have worked only online and remotely for years before the pandemic because they couldn't afford to rent, you know, a building to have a space. And I think given all this, failure to allow working from home shows that ableism is still deep-rooted, and society is sort of missing a big chance to address it by taking away reasonable adjustments as soon as non-disabled people no longer need them. And I think that's the biggest challenge that we are facing right now, especially in the UK, where the government is pushing, as I said, for a return to normal. But I think we need to ask ourselves whether that normal was actually working and what we lose when we choose to go back to it. Also, in terms of the loneliness that Ratan was talking about earlier, in that, you know, I'm a freelancer, I work from home, and I like working from home because I can manage my symptoms, I can be in control of my environment and my disability. But it's, you know, sometimes it's not a choice because public spaces are not accessible to me. And so I think we need to reflect on what returning to normal means for everyone.
The next question follows on nicely from that, which is about what should governments and NGOs do now? Because we've seen how disabled people were excluded in planning. What are the lessons to be learned, and what are the best ways going forward for to engage with disabled people for policymakers? Hala, would you like to answer that one?
Sure. Now, we all know that between international principles and practices, the world leaders about this in very high levels, but we are looking forward for the implementation, that everyone should be committed to the advanced disability inclusive development through the adoption of the action-oriented outcome. We hear stresses for the importance of ensuring accessibility for and inclusion for persons with disabilities in all aspects of development and giving due consideration to all persons with disabilities. It further calls on governments and international community to take actions to ensure accessibility. Here in Jordan, we can find many projects, especially in the non-profit organizations that work for persons with disabilities and with a lot of funds and a lot of resources, but it's not achieving the outcome or output that we're looking for. And when we're looking for the gaps, we found that throughout the activities moving from the managerial levels, or let's say the plans until the implementation, there are many missing points. Why all of this happens? Because of the lack of participation. While I believe in all project phases, there is a big need for participation of persons with disabilities, because we always say nothing about us without us. But why we say this? Because no one knows the pain until they live it, or no one can speak in behalf of a person who lives this case. Like we are seeing the, let's say, the mask who's the activists here or humanitarians wearing it, like we're doing, and they are publishing this on marketing profiles on social media. And for example, they're saying that they are employing persons with disabilities, but it's not an actual employment, or they are offering places for persons with disabilities in some companies or private or governmental sector, but it's not really available, or maybe they only available for one disability despite the others. And this is still discrimination, while they reject to make the holistic process of inclusion. Again, the engagement of persons with disabilities in projects is a really, let's say, important indicator to achieve the project success. Because if there is no planning, if there is no, let's say, accurate planning, there will not be an effective and quality of implementation to achieve the change that we're looking forward in all aspects. Like we here in Jordan have also many, let's say, variety in the community. We have refugees, we have persons with disabilities, we have elderly people, and we have youth, and we have women with disabilities. So each one of this has its own obstacles and challenges. And for women with disability, maybe we can find double discrimination also. So this means a lot of work. And for me, I believe, maybe, I don't know if that's right or wrong, but for me, I believe that in every project that works for persons with disabilities, it should be a consultant from disability side, because in all activities, in a very little details, there is many differences. And for also, I believe that there is no disability take the place of the other, like physical disability. It's not taking a place or speak on behalf for blind people, for example. So there's a lot of work, but we feel disappointment maybe, or we feel the change is so slow, but we're still calling as activists, because the change takes a lot of time. But we feel maybe disappointment because we see like unconsumed or bad of consumption for resources that we're gaining here for many projects, because the output, or again the outcome, is not achieved as we want it to be. And no one is knowing or discovering this, because it's not that appeared. Maybe it's invisible, like the slogan for this year for the International Day for Persons with Disabilities. Not all disabilities are visible. So we are looking forward for more engagement throughout the consultancy for persons with disabilities. And actually, as an activist, I started calling to engage all the targeted group in any project to be participated, not only persons with disabilities. So this is for the context of Jordan and Arab countries, and we're looking forward for more engagement.
Thank you very much. I think we'll move on to the final question.
Can I just say something about that?
Yes,
please?
okay.
Yeah, I just wanted to first say that COVID-19 has not just exacerbated the challenges facing persons with disabilities, it has also exposed those challenges. And so if it is just us activists who are saying this to governments and NGOs, now they are seeing it for themselves. So one, it's important that they take social inclusion very importantly, because without it, then we see segments of societies impacted differently by disasters such as the pandemic that we just witnessed since last year. Number two is that we need DPOs, disabled persons organizations, to be involved in the programs, in all the development strategies that we are making as government, so that not only are they to be involved, but they ought to be empowered, so that they play their roles in a proper manner. Number three, we need to have a situation where all programs, all strategies that are designed to mitigate the challenges facing persons with disabilities must have their involvement, right from the designation stage to the implementation to the evaluation. so that disability is not an afterthought. It's not because an activist, a disability rights activist has mentioned it, but it becomes an integral process of development. That's why we have it in the Sustainable Development Goals. And lastly, we got to have accountability mechanisms inbuilt by government and NGOs, not for the sake of looking for funds, but for the sake of monitoring the actual progress made in disability inclusion. Because it's this lack of accountability mechanisms that has made it difficult to know where we have reached with all these things. We have so many NGOs working in countries. We have all these things that governments are doing, but we don't see the tangible results. And to see such tangible results, it will take governments and NGOs to put in place accountability mechanisms with clear indicators. So that's something that I really would want to emphasize.
Thank you very much.
Really
I think
agree.
we'll move on to the audience Q&A now. So if you have any questions, please raise your hand or stick them in the chat. I think it's really good to see there's been a lot of discussion. So I'll just have a quick look through the chat. Very happy to share a copy of the PowerPoint presentation, and I will check if the recording of this event will be available, made available as well. So there will be another repeat of this event where we're just showing the recording, and on the 25th of November, which is a Thursday, I think at 6 p.m. GMT. So if you have any friends or colleagues who were not able to attend today, they may be able to attend the recording instead. And this, we can include that in the communications going out after this event. It looks like there's a lot of discussion about digital poverty is a concern in the UK. Yes, I think definitely that's something. I think it's really highlighted how a lot of the issues, as Samuel said, are shared between developing countries and low middle income countries. We see a lot of the same issues, and I found that during the literature review, a lot of the issues I was actually living through while I was writing about them, which was quite kind of a harrowing experience at times. Many of the students, let's just check my messages. Yeah, I think there's a lot of discussion about access to education in particular, and working from home. And the need to go back, being forced to go back to normal rather than trying to build back better and learn from the discussions. I can't see, unless I've missed anything, any kind of specific questions. So if you have any questions, particularly to any of the panel members, please highlight them again in the chat, because it's difficult to kind of go through all the messages.
Vera, I think there's one question fairly early on that is directed to the panel. It says, education departments provided childcare for disabled children, but not for children of disabled parents. Does the panel have any experience or opinion on this?
Anyone want to comment on that? I think I can take that.
Yes, can I say?
Oh, yeah, okay, you go ahead, Samuel.
Oh, okay, great. I just wanted to say, yes, that has become a huge challenge in Kenya as well. And my term at the board of the National Council for Persons with Disabilities just ended last month. And I remember before our term ended, we discussed this and we agreed that, look, we need to have a pilot program to target children of persons with disabilities. Because we give educational support to learners with disabilities. But up until the time we started this pilot program, there was no support for children of parents with disabilities. Parents who have a disability and their children are not disabled, they didn't have such support. So we started such a thing. And I think it's something that we need to encourage that, because persons with disabilities bear children that are not disabled. And because they already have problems accessing employment and they have problems starting decent livelihoods, it becomes a problem to educate their children. But most NGOs, most support that is available is always for children with disabilities and not children of persons with disabilities. I think that's an area that most developing countries rather want to think through. I am not so sure about what goes on in developed countries, whether there is such support, but yes, in the global south, that's a huge problem that governments and NGOs need to think of and try and mitigate it. Thank you.
Yeah, I think it's very similar in the UK. It's just not. I think the assumption is disabled people don't have children. I'm a disabled parent, and I really, yeah, we're disabled, two disabled parents, and a 5-year-old, and it was a real challenge to manage doing any sort of work while also undertaking childcare and without basically trying to collapse. So the next question we've got is, do you think online support groups played a vital role during the pandemic? Anyone have any thoughts on?
I think personally, yes, in that I normally live in the UK, but I'm originally from Italy, and so during the various lockdowns, I've always gone back to Italy to be near my family, and to me, having access to online support groups in any shape or form was a huge resource in terms of being able to socialize and being able to keep that sort of international connection that I felt like I needed, and also being able to see what was going on in other countries. And I really found that beneficial, and also was an opportunity to learn a lot more about myself, I think. So yes, definitely. And I know that a lot of support groups are still going, and I hope that they will keep going, even if, society in general sort of goes back to normal.
Thank you. I think the next question, I think we'll have time for a couple more questions. There's one that's really interesting about the need for accountability. What do you think what would accountability look like from governments or policymakers?
Yes, this is Samuel. I mentioned about accountability measures that are required. Yes. You see, I think one way could be by way of releasing progress reports to the public, because there are monies that are budgeted or allocated for disability-related programs, but most persons with disabilities don't get to know what is it that has been done and what challenges are and what is needed to be done. So when those reports are shared with persons with disabilities, they are able to also help in monitoring. Another way would be these reports not just being shared with the public, but also being shared by oversight bodies like Parliament, because then they can ask questions, they can ask relevant questions that are helpful in ensuring that programs that are actually implemented or are designed and implemented to improve the living conditions of persons with disabilities are actually done. I think another thing is that the heads of programs, heads of departments must take seriously some of these policies and programs that they are implementing, and they must have committees within their institutions that monitor the implementations of these programs. And the head must take, personal, I don't know, let me not call it personal responsibility, but they need to be a bit more involved in ensuring that actually there is progress. Because what I'm seeing in the global south mostly, particularly in Kenya, is that we can be quick to formulate policies, but very slow at implementing those policies. So, it doesn't help to have a policy if you are not willing to implement it. And to show that there is willingness, there has to be some level of accountability and responsibility involved.
Thank you very much. I think we've got a hand for, sorry, is it okay if I just take the final question, just because we have 3 minutes left? Steve, you've got your hand up. Would you like to ask a question?
Yeah. Going forward in the climate crisis, technology is going to play a crucial role. So it was mentioned before, disabled people especially supporting those have technology. Now, through the pandemic, we need technology.
We can't hear you very well. You're very tinny.
Is this better?
Yes, that's a little bit better.
Going forward in the climate crisis, technology is going to play a crucial role. From working from home to GP surgeries to healthcare, local politics as well. And as mentioned before, disabled people can't afford technology, especially in the global south. So how do we make the G7 leaders listen to us? Because in the UK government at the moment are ignoring this. It's very pleasing.
So how do we get people, governments to listen to us about technology? Ratan, do you want to answer? It's about how can we get governments to listen to us, especially about access to technology?
I think I can speak from my own experience in India. It could be limited, but I think non-profit organizations have played a very vital role in foregrounding the problems of access to technology. Because I think it's not only access, it's also about affordability, right? Access and affordability are intricately tied in countries like India. So I think grounds up, first and foremost, I think the education, the highlighting the importance of accessibility to technology is something that needs to be done in order for any policy to take effect in situations like that. I think till now in India, technologies and disability and the need for providing access to technology for the disabled people, the disabled community, has never been an important agenda until pandemic actually highlighted this. And I think that is where the conversation started. And I think there has to be active policy making with involvement of non-profit organizations that actually reach out. Because I think non-profit organizations in India play a very vital role in connecting policy bodies with the people. Otherwise, the bridge, the gap is very big. So I think there's a multi-pronged approach that needs to be taken up. I mean, I can't elaborate more, but I think to summarize, I think it's a grounds up approach that needs to be done in order to make accessibility an important agenda for any government to.
Thank you very much. We're out of time now. So thank you very much to our lovely panel, to our technical support team, and obviously, of course, to our BSL interpreter and caption nurse. I've just put a feedback survey in the chat, so that will be sent around to you by email as well, along with information about if the presentation and potentially the recording. I'm not sure if we're able to share it, but thank you very much for attending the event and for again, to our panel for a really interesting discussion. I hope you find it helpful and informative, and that this is the start for next steps. Thank you very much.